Hey, deserving listeners, it's just me today. I thought I would respond to patron emails. I would read your emails and then I would provide some responses. After a little bit of prep, incidentally, I hardly ever just respond off the top of my head. I usually do some research and stuff. And so just know that. This is the Psychology in Seattle podcast. I'm your host, Dr. Kirk Honda. I'm a therapist and a professor. This email is from patron Matt from San Diego. He writes, "Hey, Dr. Kirk, you've mentioned that you like It's Always Sunny in Philadelphia, the TV show. I've always thought Dennis and Charlie were characters ripe for psychological analysis. If you ever get free time to do another pop culture episode, I would love to hear your thoughts, seeing as Dennis is a total narcissist and essentially a sociopath, and Charlie seems to have a troubled past." Yeah, I have watched It's Always Sunny in Philadelphia 2 or 3 times through, and every night I will probably watch at least one best of clip on YouTube. I just love that show. It's a guilty pleasure. I can't justify it. These characters are awful human beings, but they tickle my funny bones, so what are you going to do? Yeah, if I were to analyze their personalities, these are, of course, fictional people, and, you know, the show is a bit of a card. I will say, if you've never seen It's Always Sunny in Philadelphia, the first time I watched it, I hated it. I thought, this show is stupid. But then it was sort of like the first time I watched The British Office. I didn't like it. And then when I came back to it, I don't know, months later, suddenly it occurred to me I saw it for what it was, which was a genius show. Both of those shows. Yeah, all the characters, Dee, Dennis, Charlie, Frank, Mac, they all have horrible childhoods filled with actual abuse, neglect, abandonment, sometimes not knowing who your father is, substance abuse, possible even sexual abuse on Charlie from his Uncle Jack, and also seeing his mom work as a sex worker while he was a child. So, you know, it's all jokey stuff on the show. And of course, if you've never watched the show, you're just like, what? That's a comedy, but somehow they make it into a comedy. But anyway, the idea would be that why would these 5 individuals have such a history of all these problems? Well, one is 3 of them are related. So there's that. But also in the reunion episode, which is one of like the high school reunion episode, it's one of my favorite episodes of It's Always Sunny. And it's a 2-parter, I believe. And you realize that the high school kids were more normal, and these guys were very strange individuals. And it would seem that they stuck together because they were the only people who would tolerate each other. So there's that. If I were to analyze their personalities, you know, you're mentioning that Dennis is a sociopath. They're all psychopathic. If you just look at their behavior as it is, like without a comedy lens, all 5 characters are some of the most psychopathic individuals you will ever meet in the world. They lack empathy for other people. In almost every episode, they do horrible things to each other and to other people. I just did a quick scan of season 10's. There's something like 12, 13 seasons. And so just to get some examples, I just went to season 10. I don't know why. And so I'm going to list some moments from season 10 that exemplify their personalities. I will say that even Dennis isn't, you know, these are cartoon characters, right? These are not real characters. And so they don't really, there's no way someone could actually be like this, is the thing. You know, in some ways, all 5 of them completely lack empathy for other people, and they will use other people to their own gain all the time and use each other. But at the same time, there are moments for all of them in which they have actual empathy for other people and seem to really care about other people's feelings. So it doesn't make any sense in the real world in that way. You know, if they made actual psychopaths, you wouldn't like the show and it wouldn't be funny, is the thing. So anyway, So in almost every episode, you can see them do at least some psychopathic behavior. For example, season 10, I think the first episode, they're on a plane and they're trying to beat some baseball player's record of drinking 50 to 70 cans of beer while they're on the airplane. And on the plane, Mac smuggles an entire suitcase of beer on board, and Frank gives this kid on the plane a possible lethal dose of sleeping pills. So right there, it's just like Mac breaks this, law by bringing beer on the plane, and then Frank almost potentially kills someone with sleeping pills. And actually, I'll say that when I watch shows like this, and they do stuff like that, I actually don't think that's funny. I think, there's certain funny things that other people think are funny where I'm just like, that's a little too far in some respects. Like drugging someone with substances and possibly killing them, that's not funny to me. Anyway, they all use cricket. If you know cricket, all 5 of them completely use and abuse cricket all the time. In another episode, Charlie gets angry and he tries to get their bar patties ready for their annual health inspection, but the rest of the gang involve themselves in this scam involving airline miles and steaks and chickens and all these other kinds of things. And so they're always trying to work an angle, which is totally a psychopathic thing. The Bill Ponderosa character, also potentially psychopathic himself. In season 10, there's an episode where he tries to drink himself to death, like in Leaving Las Vegas. And Frank and Dennis and Dee, they try to profit from Bill Ponderosa drinking himself to death. Also in season 10, in every season, they use Frank for his money. In every season, they will bully Dee. And in another episode in season 10, Dennis has created a fake cult to trick Mac out of eating his Thin Mints, if you remember that episode. So, very vindictive, vengeful, lack of empathy, trying to get what they want at the expense of others, very, very psychopathic, antisocial. They're also all suffering from substance abuse problems, it's clear. Throughout the seasons, they use crack and coke and alcohol excessively, and they have whole episodes in which Dennis and Dee go on crack binges, and they depict that whole thing. But in season 10, the episode where they're on the plane, they're trying to beat Wade Boggs' record by drinking 50 to 70 cans of beer while they travel from Philly to Los Angeles. So anyway, another thing that you could say is that they're all basically suffering from some sort of personality disorder, some sort of massive attachment issue disorder that they act out a lot. Like in season 10, Dennis and Frank try to beat each other by getting some woman on the plane to have sex with them on the plane. So the only reason why they're having sex with these women on the plane for the most part is because they're trying to compete with each other. So there's something very strange. If someone did that, right, there's something very strange about that. Now, of course, some of you are justifiably judging me for watching a show like this if you've never watched it or you don't like it, which I get. Dennis and Dee definitely have narcissistic issues. I would say that they're the most narcissistic, Dennis being more narcissistic than Dee. For example, just in season 10, which is only 10 episodes, by the way, in one episode, Dennis is obsessed with a website that allows women to rate their dates with men. And he uses the waitress and a bunch of other people to try to get people to rate him higher. He's not interested in connection with other people. He's only doing all these behaviors because he wants people to rate him higher. And Dee basically does the same thing. She has sex with a bunch of men and every night, and in the hopes that they will rate her to give a bad rating. She wants them anyway. The point is that they're very interested. They're overly focused about how they look in other people's eyes. And just as another indication of narcissism and psychopathy is that in the 12 years that they have known, quote unquote, the waitress, they've never bothered to learn her name. Even though I think in the high school reunion episode, they actually revealed her name. Anyway, Mac, if I was to look at Mac, he definitely has abandonment issues. And, his dad abandoned him, and his mom was extremely neglectful emotionally, I would say, just, sort of blank and checked out. Season 10, Mac, and his father, Luther, is in jail on a murder charge, and Mac desperately tries to prove his innocence, but it, of course, backfires. So that's kind of an element of Mac's personality, right? Charlie, I would say, is some kind of dependent in some ways. He has a hard time doing things on his own, and sort of requires mothering by other people. You could also say all of them, but mainly Charlie has some sort of learning disability or some sort of developmental disability. Although, Charlie globally, his intelligence seems to be actually pretty good. The writers of the show, one of the complaints I have is that they're kind of inconsistent with the characters. Like Charlie, during the episode in which he's trying to pass the health inspection, he's like a genius who can like pull all these different things together and manage all these weirdos and pull the wool over the inspector's eyes. And, he's just this Machiavellian genius. And then in other episodes, he's illiterate and he doesn't understand things. And so, they tend to go both ways with a lot of these characters. But you can say that there's evidence that cognitively Charlie suffers from something. So that's me analyzing It's Always Sunny. I could make a full long episode about this, but I don't think it's necessarily worth that amount of time. So let's go on to another email, shall we? Okay, this email is from Patron Alexandra. Patron Alexandra writes, "Hi Kirk, I have a question. Why are some women addicted to porn? There is a lot of explanation about why men are addicted to porn, but not for women. Also, how is porn harmful?" These are interesting questions and good questions and complicated topics, but in a nutshell, women develop porn addictions in the same manner that men do. Usually as a result of trauma, anxiety, OCD, general disposition for compulsion, sexual issues, addiction, history, that kind of thing. Our society sees it differently for sure. They look at sex in a very weird way in general, porn being a part of that, and gender is, often a part of that as well. So, our society is completely busted up about sex and about gender and about porn and about shame. And so anytime you have anytime you involve all those different things, and you're going to get some weird perspectives from humans. The presentation between men and women and porn addiction is the same in my experience. You have people who will compulsively do it. It'll be an uncontrollable itch. They'll use it to escape, to isolate. There'll usually be some kind of shame spiral involved. Dissociation can be involved, PTSD or some other anxiety that is temporarily relieved by the porn and masturbation. I mean, really what we're talking about when we're talking about porn addiction often is masturbation addiction. It's part of the masturbation ritual, shall we say. It's sometimes people are purely addicted to porn and they don't masturbate at all, and they have a compulsion about just looking or compiling or collecting porn. So, there's a lot of different types, I should say, but sometimes porn addiction or compulsive porn use is a ritualistic thing. People we're very real ritualistic creatures, habit creatures, and sometimes we take a lot of comfort in following certain compulsive rituals, certain routines that we get into. Also, when we lack connection with other people, sometimes porn and masturbation can make us feel at least virtually connected to other human beings. You ask how porn can be harmful. Porn can be harmful in several ways, but the vast majority of people do not experience it as harmful. I mean, you could make the argument that it distorts everyone's idea of sexuality, which obviously is true for many, but for many people, they understand, even kids, they've done research, understand that porn is not an accurate depiction of reality. In the same way that kids understand that video games and TV shows and movies are not an accurate depiction of reality. It's a fantasy world, and so because that when internet porn first became prevalent 15 years ago, 20 years ago, there was this huge paranoia that kids were going to grow up like completely screwed up. And research has showed that although there might be some kind of an effect, our society hasn't crumbled. So there's an effect, and for some people it absolutely can be a problem, but it's not really the boogeyman that everyone thought it was going to be. There's lots of really sexist information on the internet within the porn world, but also just about porn addiction, quote unquote. It's mostly. So I did a quick Google of, women porn addiction or female porn addiction, and for the first, several pages of Google, they are all Christian sites. Some of them don't look like Christian sites, but it's actually really interesting that Christians internet sites are obsessed with sex and porn and masturbation. It's really interesting. I mean, on the positive or pro-Christian side, you could say like, well, it's a sin and people need help with that. And our society bombards people with a lot of temptations to follow in the path of the devil and to be tempted by sin. And so these sites are cropping up to help people cope with that. Another possibility is that Christians are so suppressed and repressed regarding sexuality that they just can't stop thinking about it. And they are obsessed with controlling sex and obsessed with controlling other people's sexuality and judging it. And it's just frequently on their mind because they have a hard time with it themselves. Of course, I have no way of answering that question, but I just found it interesting that I found it dually problematic. One is that the Christian sites universally talk about sex and porn and masturbation as a problem and as a sin, at least the popular sites that I saw. I also see it as a problem that our society and our psychological, psychotherapeutic profession has not been vocal enough about the reality of this. The reality is that porn addiction isn't a thing in our world. We don't, clinicians don't diagnose people with quote unquote porn addiction. We diagnose people with compulsions, but there's no such thing as porn addiction. We reserve the word addiction for very few sorts of things. And in fact, for the most part, we don't even use the word addiction for anything anymore. We use problematic use, which is much more descriptive, because addiction, the word addiction has become so fucked out in our society that most of us just don't use it at all anymore. But on the internet, you'll see plenty of signs and symptoms. And so let me just kind of go over that here. Half of the symptoms that the internet proposes that are signs of porn addiction are at least partially, if not wholly, cultural. For example, continued porn use despite promises made to self or others to either quit or cut back. So if you're talking about, say, cocaine use or something, and you're trying to cut back and you're promising yourself, oh man, I've been using every day, I need to cut back, then that makes sense, right? It makes sense. It's like, oh yeah, maybe you do have a problem with cocaine. Well, if you look at porn once a year and your society and your family and your culture is telling you that you're going to go to hell because of that, and you make a promise to yourself and to other people that you're never going to do it again, and then once 2 years later, you look at porn for 3 minutes and masturbate, do we call that a porn addiction? No, it's far from it. Frequency is rarely an element of addiction. I mean, we really just have to look at like the consequences. But in a situation like that, we'd say, oh, well, really what we're looking at here is that you have an individual who just really doesn't want to look at porn because of their religious beliefs and their moral beliefs or whatever, and that's fine. And they don't want to ever do it. And then, they do it a few times every now and then. And that's not a compulsion. That is, I guess you could say the person is compelled somehow, but we would sort of understand that as not a compulsion or addiction, right? And yet they would fit this criteria, right? Because they continue to use porn despite making promises to self that they're going to quit. So it's unclear if that one is a good indication of quote unquote porn addiction or compulsive porn use. Another possible cultural sign or symptom here is continued porn use despite directly related consequences. So again, if you're using alcohol and you're experiencing hangovers and you get fired from a job and your husband divorces you, or you end up getting an STD, all because of drinking alcohol, then yeah, you have and you're having these direct consequences from drinking. If you continue drinking, then yeah, that's a sign of problem use, right? But if you're watching porn and your society considers it this really horrible thing, and people end up judging you, and so say you look at porn and your church excommunicates you because you look at porn, and yet you keep using it, you keep looking at porn. Well, that's continued porn use despite direct related consequences, right? But is that, should we be looking at that as an addiction, or should we be looking at that as a cultural, societal issue? Again, whenever we're talking about mental disorders, as I talk about in other episodes, it's a very squishy area. So, you can make a debate either way. But the point is that all that needs to be considered. Other cultural signs are diminished self-esteem, depression, anxiety, or other emotional and psychological issues, or lying or keeping secrets about your porn use. Again, all these things could be in the context of societal shame around this. Just jump off of porn use for a second and just take an 18-year-old boy who lives in Alabama who is gay, and he is wanting to have a boyfriend, and so he's looking online at gay websites, or what do you call Tinder for gay people, Grindr, or just doing things along those lines. But if you looked at it, they would be trying, and they're beating themselves up about it because they have internalized homophobia. Well, they have continued use of this, continued behavior despite promises to cut back, continued behavior despite consequences, diminished self-esteem, depression, and anxiety because of it, and lying or keeping it secret. I mean, all of those signs are there. So would you call this person is addicted to gayness? No. You understand this is society's problem, not the person's problem. So the same goes for porn. Now, this doesn't mean that someone can't have a problem with porn, which I'll get into in a second. But now, some of the signs you'll see on the internet that are more in line with compulsive, an actual compulsion, is progressive use of porn for longer and longer periods of time. So this is a hallmark of any kind of progressive compulsion. People they need more and more and more of it, to the point where someone will be using pretty much any free time they have. Or, there's things on Reddit sometimes people will post like funny videos of people. They'll catch people looking at porn like on the bus or on an airplane or something. Someone will be watching porn on their laptop and they don't realize that people behind them can see their laptop. And whenever I see that, I think, oh, that person might actually be addicted to sex. So that's the other thing. It's like, to be addicted to porn, I've never seen that. It's usually like just a general issue with sex. sexual compulsion, so shall we say. Anyway, or masturbation for that matter. Another thing about that's really true about a lot of problem use or compulsions is progressively using more and more, and for more intensity. Sometimes they call it bizarre pornography, which is in the eye of the beholder. But another sign is escalation from compulsive porn use to other forms of sexual compulsion, like working your way up to sex workers and this kind of thing. And that's also a hallmark of any kind of compulsion. And I've worked with quote unquote sex addicts where that's the case, where it's progressive. It becomes more and more of a stretch, more and more risky, more and more intense. There were things in the beginning of their compulsive road that would satisfy them that would never satisfy them in the present. Also, reduced interest in real-world sexual activity. So, and again, the language is cultural, right? Real-world sexual activity. We tend to privilege, quote-unquote, real-world sexual activity. Why do we do that? I mean, what's inherently wrong with looking at pornography and masturbating? There's nothing wrong with that. There's nothing objectively wrong with looking at porn and masturbating. There's nothing objectively wrong with doing it every day. There's nothing wrong with that. And the internet is devoid of any sex positivity around this and any kind of suggestion of just like, well, it kind of depends on how you want to look at it. And sometimes porn use and masturbation can be a wonderful thing. It can release good feelings. It can relax you. It, relieves tension, satisfies an urge or something. I didn't see anything on the internet that talked about, I'm sure it exists, but the vast majority of the stuff and of the messages you'll see in society is along those lines. Having said that, porn, absolutely, there's problems with it politically, gender, body dysmorphia, slave labor, weird sort of depictions of sex. So there's absolutely a problem, but it's like saying that we should ban alcohol because of drunk driving. There's people who have a glass of wine at night or a couple glasses with their friends and minimal consequences, and then there's really bad consequences. Or there's alcohol being produced in countries where they're using slave labor, and that should be looked at. So it should all be looked at, but it doesn't mean that the whole thing is immoral, in my opinion. So a typical profile of someone who has a problem with pornography or sex in general is that nearly all of their time is spent in some sort of sexual activity. For example, they get home from work and they just can't, they just have this uncontrollable itch so they go home and, say their friends and family are calling them to do something and they're just like, no, I got to go home, look at porn, masturbate. I'm going to do it 3 times and then I can finally relax. And then it gets more and more progressive, where they might be seeking online partners or they might be going to sex workers. And often the actual sexual activity is just a small part of it. A large part of it is the ritual of searching. And again, it's not, if you've ever had a compulsion, then you understand what this is. But if you've never had a compulsion, then it's really hard to imagine what this is like. Just imagine somebody spending, sex addicts that I've worked with, the kinds of lives that they'll tell me about is they will go on benders essentially, and they'll get home from work on Friday and they'll be like, I'm going to let loose this weekend, and addiction or substance abuse might be involved. Actually, let's take a break, and when we get back, I'll continue this talk. All right, we're back from the break. So again, just continuing, for typical people with a problem with sex and, problem with compulsive sex is they'll get home from work from Friday and they will, in their head, they're very ambivalent about it. Part of them is just like, I know I need to not go down this road. There's a lot of bad things that I get into if I really let loose. But there's another part of them that's just like, I just want to let loose. I want to satisfy all my urges. I deserve it. I've been pent up. And they get home from work and they just say, and they go online and they might spend 8 hours looking at different sites, browsing different people's profiles, sex workers, people looking for hookups, and they'll never leave their house. Masturbation might be involved in that, but most of the time it's just searching and looking and cataloging and thinking and kind of in a daze to some extent. And then they might hook up with some, they might get a couple of drinks. They might hook up with someone later that night. They go to bed, they wake up the next day, and it starts all over again, searching and looking. And, they might get in their car and in Seattle, it's known that sex workers are on Highway 99. They might drive up and down Highway 99 for like 5 hours. They might pull over and maybe kind of chat with one of them and then go, well, I'll think about it. And then they drive away. And this is not a good feeling. This is not like the way it feels to go shopping for a new car or something. It feels the people are usually very busted up about it. They have an incredible urge. They have an incredible itch that they need to scratch. They're trying to scratch, and they're just it's almost, so the metaphor that I would have is that imagine the worst itch you've ever had, on your leg. You have this incredible urge to itch your leg, but you can't, or no. Here's a better one. You have a incredible itch in the middle of your back, and it's the one spot in your back that you cannot reach with your arm. You are trying to get it and you just can't get it. That's what it's like. That's what a compulsion is like. And you can't do anything, right? You can't think. You can't love other people. Your mind is consumed by this itch that's just pounding away in the middle of your back, and you cannot reach it, and nobody can. There's no back scratcher. No one can, and so you spend all weekend long searching for a way to itch this thing to the point where your life just kind of burns out, and then you just go back to work on Monday. And so, or some people just completely go on, weeks and weeks of benders. And so that's what compulsion is, right? Looking at porn for 10 minutes in the evening and masturbating is, I hope you understand, far from that reality, right? Now, I hope you understand that we can't really put a time limit on this, because certainly for some people, their compulsions can be quite short. But really, it's all in the description. When you talk to people, and I've talked with a lot of people about this, when they come to me, I'm like, they're like, I have a porn addiction, or I have a sex addiction. I'm like, okay, if someone came to me and said, I have a problem with smoking cigarettes, I don't need to really do this with them, because we don't have as much of a busted up culture regarding cigarettes as we do about sex. So when people come to me and say they have a sex addiction or a porn addiction, I have to spend several sessions just kind of sifting through what they mean by that. I take a full assessment of their behavior, why they feel the way they do about it. Have they ever had a balanced life around it? How do they, what messages, religious-wise, did they internalize about these things? And it takes a long time. It's a collaborative process. Now, if someone has a quote-unquote problem and they self-identify as having a problem, even if they only look at porn every now and then that's fine. I wouldn't define that clinically as a compulsion, but anyone can make any goal in their life that they want to make, right? If someone says, I never want to look at porn for the rest of my life because I don't want to, and I want Kirk, you to help me to do that, then I'm here to help. I'll talk with them about like, well, you realize that you're not mentally ill, and you realize that there's nothing really clinically wrong with you. And they're like, and we might talk for a number of sessions to kind of explore that. But in the end, and I've had clients like that where they're just like, yeah, I get that I don't really have a problem with this. I get that my impulse is normal, but I just morally and spiritually I believe that looking at porn is wrong and masturbation is wrong. and I just want your help to refrain from it. And I'll be like, okay, great, that's fine. I'll tell them that I have reservations about this sort of sex negativity they're involving themselves in, but everyone's free to decide what they want to. So yeah, another analogy you might have is that if you're trying to lose weight and you vow that you're never going to eat another donut, and you eat a donut once a month because you lose willpower or something, then we wouldn't call you a donut addict, right? We would just call you a normal human who went off track on your weight loss program. And we would just say, and if you went to a therapist to say, please help me to stop eating donuts because I'm trying to lose weight, then okay, that's fine. I might, say, a donut every now and then is okay. And if they're like, no, I don't want to eat a single donut, it's like, okay, fine. So, but we wouldn't call that person a donut addict, right? Well, why do we go so far to just label any kind of, thing in this category, sex addiction or porn addiction, right? It's because of our stupid culture. Okay, so looking at research, there's a lot of terms in the research literature. Sometimes they refer to it as self-perceived pornography addiction, or SSPA. Now, this is an interesting term because basically what they're saying is like there is no such thing as pornography addiction, but there's a lot of people out there who perceive themselves as having pornography addiction. So we are going to label that as self-perceived pornography addiction. Another term that I like, which a lot of researchers are using, is problematic online pornography usage. So it's not just porn, right? It's online porn, right? And if someone has a problem with it, then let's just call it, problem online porn use. Also, in the literature, the consensus is that porn addiction is not a formally recognized disorder, as I was talking about before. And in the research literature, a lot of researchers are pointing to the fact that there's a lot of disagreement regarding what its definition is, or even if it exists. So in the world of psychology, it's not a controversy that the research literature in the field of psychology is more in line with the way I'm thinking, whereas society has a completely different point of view. And, people out there who are researchers and educators and therapists, I think we all need to do a better job of getting the word out, because I think a lot of people are suffering unnecessarily, or they're not seeking help because they think that it's stigmatized, or we don't talk enough about it or something. Anyway. So a lot of research about online porn is more recent, obviously. So in 2016, these researchers found that self-perceived pornography addiction is most frequently operationalized by researchers as excessive pornography use and the negative consequences that come with it. As a result, researchers tend to focus on the frequency of pornography use and related impact as determinants of SPPA. So, in other words, what these researchers are finding is that a lot of times researchers will just reduce quote-unquote porn addiction to frequency of porn use. And what these researchers are saying is like, well, you can't really do that, right? Because some people can use a lot of porn and be fine, and some people can use just a very little bit of porn and actually have it be a problem. But it's a lot easier to ask someone, how often do you look at porn? It's much harder to numerically measure the impact of porn, particularly because of culture, as I've been talking about, right? Other things here. Self-perceived pornography addiction is reported to affect users and their partners in similar ways, such as increased feelings of isolation and relationship breakdowns. However, we found some methodological, basically in this study, when they're looking at other studies, and they found a lot of limitations in a lot of the other compulsive porn use research. It's just a really hard thing to research. A lot of the actual journal articles that I saw were actually looking at societal impacts on the way we look at porn addiction rather than actually looking at porn addiction itself. Another study, 2015, found that the majority of therapists providing individual or couples therapy have seen clients with identified pornography issues over the past year. So about 75% of individual and couples therapists report having some client come to them with quote unquote porn issues. Now, whether or not those people actually had porn issues or not, but it's interesting that, a majority of therapists say, yeah, people come to me to talk about this. And yet, we barely ever talk about it in the clinical world. Another 2015 study, 67% of male university students believe their pornography use is an acceptable form of behavior, and 20% found their behavior to be unacceptable. So about a fifth of college students, who are usually the subjects of these kinds of studies, report that their porn use is quote unquote unacceptable. Now, and in the study, they're not saying that's actually unacceptable. They're just saying this is how they just perceive it. 50% of boys and 32% of girls who viewed pornography experienced guilt or shame in relation to this behavior. So this is actually an interesting statistic, is that of the people who look at porn, boys and girls, boys are more likely to be ashamed of it than girls are. So isn't that interesting? Now, if you depend on the internet to give you statistics, you are going to be led astray. There are lots of terrible stats that I read on these Christian sites. One stat was 70% of men report having a problem with porn, which is counter to all the other actual psychological studies. 70% of men report having a problem with porn. Like what? Like, nearly every man has a problem with porn, huh? Now, I'm not hacking on Christians. I'm hacking on these particular Christian sites I saw. I know many Christians who have extremely sex positive, sex forward ideas. So anyway, yeah. So what else can I say about it? I've treated women who have issues with porn and masturbation and sex. Again, it's this. It looks exactly the same as it does for men, and there are women who report it's like they would have a tension build up over the day, and they would sort of rush home and masturbate, or rush home and look at porn and masturbate, and it was their only way of relieving their tension, and they didn't feel good about it, and they would isolate a lot. And when you masturbate an orgasm, it releases actual chemicals in your brain, usually, that can it's like a dopamine rush, like heroin or something, or alcohol, and it relieves tension. And if you're suffering quite a bit, then it's one way that you can actually develop into a compulsion, because your brain learns, that was good. Keep doing that. I need that. And really, the problem is not the quote unquote addiction. It's the issue is that someone's suffering and they don't really have any other way of healing or working on that, which is really the driver of the vast majority of quote unquote addictions. I've never met someone who had a problem with heroin or cocaine or alcohol or marijuana who wasn't driven by some loneliness or PTSD or attachment issues. It's always been the case. So this is no exception. I could go on and on, but let's end there and go on to another email. Okay, this next email is from an anonymous patron. They write, "Dear Dr. Kirk Honda and Umberto, so I'll just take this myself. Sorry, Umberto. I was wondering if you could talk about the best way someone should enter a relationship with another person that is a recovering drug addict. I recently met a really amazing guy, but he has opened up to me about his struggles with narcotics. For the past 2 years, he has been working on being sober. He has gone to multiple rehabs, is currently living in a sober living apartment, goes to meetings daily, and has a good relationship with his sponsor. All that being said, from your podcast and from my own personal history with an alcoholic father, I feel as though he is on the right track and is fighting this battle the best he can. However, I know he has slipped up a few times in his recovery. The last time he used substances was 6 months ago. I really do like him and would want to be in a relationship with him, but I have concerns. Is it even a good idea for him to start a relationship with me at this time? Could a possible breakup send him into a relapse? How do I go about going out to bars and clubs when I feel it might be hard for him to hear about that? Okay, good questions. Complicated issue. First thing I'll say is that, patron, you are very healthy for exploring this. Instead of just blindly going into this, it's like, there are some questions. And these are all important questions to continue exploring. There's no way I'm going to be able to answer them here. These are things that time will tell. But the one thing I will say is that, in general, people in recovery can be wonderful partners. People who are in the midst of substance abuse can be wonderful partners. There's really nothing, there's no way of knowing. There are people who don't have a history of substance abuse that are terrible partners. So there's just no way of knowing. And there's certain dogmas that people will say. It's like, well, when you're in early recovery, you don't want to be in relationships. And some might consider him to be in early recovery. But, you really have to take on a case-by-case basis. Sometimes being in a relationship can actually really help, So it's hard to say. And sometimes people in recovery can actually be better partners than other people, because when you go through recovery, you really have to look at yourself, and you really have to take inventory, as they say, of your life and of your issues. And you have to build up really strong support systems, and you have to take responsibility for your behavior, and you have to put effort into healing. And so sometimes people in recovery can be really self-aware and caring. So, being in recovery can actually be a pro and not a con. The other thing is many, many people are actually recovering from an addiction of some kind, whether it be cigarettes or alcohol or, many people are recovering, whether they identify as such or not. And so if we said we're never going to date people in recovery, we would be limited to very few individuals. Now, having said all that, there are risks to dating someone who is recovering, especially in early recovery, but really even 20 years later. I mean, the sort of issues that lead one to become addicted to narcotics is, usually, like as I've been saying, it's usually trauma, PTSD, family of origin issues that don't go away even after you recover. And so, it's complicated. But to go over some of your questions here, is it even a good idea for him to start a relationship with me at this time? Again, it's hard to say. And really, I wouldn't worry about that yourself. That's his journey. It's his recovery. That's up to him. You can ask him. You can be like, so, do you think it's healthy? And are you exploring that in your groups? Are you talking with your sponsor about that? But really, that's up to him to decide. That's not your responsibility. You ask another question, could a possible breakup send him into relapse? This question actually is a bit of a yellow flag to me regarding where you're coming from. I mean, it's great that you care, and it's great that you don't want him to go into recovery, but to put that burden on yourself or to take on that burden is kind of classic codependency and a bit worrisome. To worry that, oh no, I better not break up with him because that'll cause him to go into relapse is not your responsibility, not a helpful attitude, honestly, and ultimately not good for him because, let's say you stay in a relationship with him and the only reason why you're in it is because you just don't want him to relapse. He would get that energy and that wouldn't be good to him. So it's a little bit of an interesting question that you would even ask that. So I just want to emphasize that you probably should be exploring this in Al-Anon. You should have a relationship with a sponsor maybe. You could go to AA meetings or NA meetings with him. I would, if you really want to explore this and really want to hit this head on, going with him to meetings, having a relationship with his recovery, being a part of his recovery can really help, not only in sort of alleviating any fears you have, but also bringing you guys closer, maybe, if he wants you. Maybe he doesn't want you to come to his meetings, so you have to ask him. But at the very least, I'd go to Al-Anon meetings because you seem to be exhibiting some attitudes that would lend itself to Al-Anon meetings. And Al-Anon meetings are for family members and loved ones of people who are in recovery or who should be going through recovery. You ask another question, how do I go about going out to bars or clubs when I feel it might be hard for him to hear about this? I would just talk with him about that. And it's good that you care, and it's good that you're thinking about that. And I would just ask him how he feels about it. At the same time, you have rights, and if you going out to clubs and bars triggers him somehow, that doesn't necessarily mean that you don't get to go out to clubs and bars. So don't sacrifice your life for his recovery is the thing. If the way you live your life normally challenges him, it's kind of up to him to figure out how he's going to navigate that. You don't have to codependently ruin your life just because it makes things easier for him. At the same time, you have to balance it out with being realistic, and like you wouldn't want to have a party in your house with a bunch of people drinking or using drugs when that would challenge him, right? So there's a gray zone there in terms of being a responsible, nice partner, and also not giving up your entire life for another human being in their recovery. It's a very squishy thing, and it really requires a lot of exploration. And the nice thing is 12-step groups have a lot of history and a lot of wise people who have been through things like this. And you'll get different opinions, but it's worth exploring and talking about. The key is that you just continue to talk about it, continue thinking about it, continue exploring. And really, if you find yourself heading down a codependent and a sort of selfless road, other focused road, really, as they say, take inventory of that and make sure that you're not dysfunctionally giving away your life for someone else's recovery. Again, it's great that you care. It's great that you are trying to help, and you should care and you should try to help. But there's a line between that and dysfunctionally giving up yourself, which of course you would resent, and then passive aggressively take that out on him. And he wouldn't like that either, because he doesn't want to be involved with someone who's empty. He wants someone who is there. And that means, being a real human being with your own wants and your own identity. So hope that helps. And again, go to meetings, maybe get a therapist, go to Al-Anon. That's always good things to do for everybody. And that does it for that episode of Psychology in Seattle. Thanks for joining me. If you have comments, you can email me at contact@psychologyinseattle.com. That's contact@psychologyinseattle.com. Also, if you're not a patron yet, do so now. Go to patreon.com. You might have to actually go to a computer and sign up. That's the best way you can show your love for the podcast. We're getting close to our next Patreon goal, in which we will start a scholarship fund for needy and struggling students who want to study to become a psychotherapist. So we're getting close. So go to Patreon right now if you haven't already. And that is it. Thanks for joining me. Please take care of yourself, because you deserve it. You really, really do.